This is your Houston chiropractor, Dr. Gregory Johnson. We have Tamara here with us this morning, and Tamara is a nurse, and she lives in Lubbock, Texas, and came all the way over here from Lubbock to see us. She has been to various physicians to evaluate her multiple joint pain. She's got pain everywhere, upper back and right shoulder blade, the next second biggest issue, but that also goes out into your right shoulder, right?
Yes.
And then your mid back here, both wrists, both hands, right one worse, ankle pain on both sides, knee pain on both sides, dizziness occasionally, and some dyslexia and ADD. And you said your TMJ's locking up worse on the right side over here, right?
Yes.
Okay, and that happens how frequently?
Maybe every other month, but on the way up here it was worse.
Okay, I'm talking too much?
Possibly.
Okay. She's been diagnosed as having fibromyalgia, correct?
Yes.
By the physician.
Yes.
And fibromyalgia is a kind of a catch-all diagnosis for most physicians when a patient comes in with widespread pain on that. I mean, you have to be able to find a certain number of trigger points and specific indicators for fibromyalgia. And I've done her orthopedic neurological evaluation and her history. And you being a nurse, how would you describe my history taking and examination of you?
Very well. Very good.
Thorough?
Yes.
Good. Okay. So let's show them what your posture looks like first. Let's have you flex your hip forward and backwards. And then neutral. See, her head's forward and translated to the left. She can't keep her eyes closed too long because she gets dizzy. Forward and left. And then down here in the pelvis, her pelvis has translated to the right of center. She has no room over here. No, don't move your arms down. No room over here, and she's got a little room over here. So I'm going to go ahead and start adjusting her spine. Let's go ahead and lay you on your stomach here. I've already went through all of her medical records that she brought. We discussed that. I'm not going to divulge those to you on a video. Violate her HIPAA privacy. Her leg, though, is shorter on the right, and then I bring it up and it gets even, and you see her pelvis raise off the table right there. You see that? That tighten up in your lower back and thighs a little bit when I brought your legs up?
Yes. More on my right thigh.
On the right side? Yeah, and the right side's the one that showed the most sacral deviation too. Now she's got bilateral SI joint problems here. I'm going to do a sacral deviation test on her. Go ahead and lift your right leg up. Okay, now do the same thing on the left side. Now clearly her right leg did not come up as high, and you said you felt more discomfort on that right side?
Yes.
So she has a right sacral deviation along with sacroiliac misalignments, which is the sacrum and the ilium are not articulating properly, which is causing dysfunction down in her SI joints, which causes her to have leg pain. She's got tenderness upon palpation, L5, L4, L3, L2, all the way up into the lower thoracic region here. She's got a lot of ribs misaligned with the thoracic spine vertebrae, and when I'm palpating her thoracic spine, she's got a curvature or scoliosis in her upper and mid-thoracic spine. That's really tender right there, huh? Mm-hmm. And there's where you get that shoulder knot a lot, isn't it?
Yeah.
In your shoulder blade, that's your rhomboids. Levator scapula here on the right, trigger points in the trapezius muscles bilaterally, but the C6 and C7 are subluxated to the right, C3 and 4 on the left, and then she's got an atlas hanging out on the right so far I can hang a coat off of it. Okay, so you ready for your very first adjustment?
Yeah.
Okay, so I'm going to start off adjusting your right sacral deviation. And then the SI joint. Oh boy, did you feel that one? That one moves significantly. Usually you don't hear as much of a articular cavitation. Now her legs are exactly even. Do you see that? And this should feel a little easier already than that first one did.
Yes, it does.
Yeah, imagine that. Okay, so now I'm gonna move up into your lumbar spine. There we go. That's it. Good job. Okay, you're gonna feel your head popping up a little on this next one. I'm gonna put the curve back in your cervical spine. You've lost your cervical lordosis. Get your head back up over your spine. Okay, let's turn you on your back now, please. So you've been taking a lot of different medications for these disorders they've diagnosed you with, right?
Yes.
Is any of that helping you?
With my focus.
Well, I mean outside your ADD stuff.
No.
For the widespread
Joint
pain
pain,
that
no.
you're having. Let's put your arms out like this. Not straight out to the side.
Yes.
Yeah, my Jesus adjustment. Slide down this way just a little bit. Get your clavicles, your anterior ribs here. Good. Okay, now just relax your leg in my hand here. Now you complained of some ankle pain bilaterally, so I'm going to start all the way down here. But you should have felt that all the way up in your lower back.
Yeah.
Okay, same here. Relax. There you go. Did you feel that one all the way up too?
Yeah.
Good. Okay, let's hit you up and face towards Luis. There we go. Ooh, your shoulders got a lot of skip jumps in it. There you go. Yes, ma'am. Crack-Eight's gonna love you. You're noisy all over. There we go. That's your wrist that was hurting.
Yeah.
Good. There. Mm-hmm. Yes, ma'am. Okay, good. Let's have you come over here on this table now. Okay, Luis. Okay, I'm gonna have you put your butt right here. Head up this way, please. Slide down. There we go. So let your legs relax and bend naturally. This is the way I recommend you start sleeping, by the way, is on your back with your legs elevated.
Okay. I tried.
No pillow.
Okay. I tried after watching one of your videos. It's just very uncomfortable.
You know what Try did though, right?
Didn't work.
Nothing.
I was back on the bed by the end of the night.
Okay, there we go. Yeah, well, I didn't do it overnight either. It took me like 6 months to change my sleeping pattern. I had to build a fort around me with big pillows. Could just breathe. There you go.
Oh,
Yes, ma'am. You should have felt that all the way down. How'd that feel?
really good.
Yep. Oh boy. Yes, ma'am. And yes, you are still kicking. Okay, so let's kind of get up sideways and push yourself up with your left arm. Yep, and we're going to stand right here in front of the mirror for me again. Okay. I'm going to have you close your eyes again and bend your head forward and backwards. I'll make sure you don't fall over. You probably should feel less dizziness right now, though, anyway. Yeah, see, you're not weaving as bad. Look. See, your head's up higher,
Yeah.
and you got more equal spacing down here now. But here's your homework. You're going to lift up, lift your shoulders straight up, pull them back simultaneously, hold them there. flip these here. See, that tightens up the whole trap.
Mhm.
Now your head is forward and left, so we're gonna bring it straight back this way. We're gonna translate you to the right, cause yours is left. And then look at the wall behind you. You're gonna feel a little tap on your atlas right there. Another one right there. Wow, you're the first person this week that's got that right. Relax. Okay, relax. Now, when you bend your head forward and backward, begin with your eyes closed. Tell me if this feels any different to you than the previous two.
Yeah.
In what way?
I don't feel as dizzy or lost.
Yeah, but do you feel less stiffness? Does it feel smoother to move your neck? After I did that instrument adjustment on you?
Yes.
Okay, so walk around for just a second
Okay.
and tell me if you have pain anywhere besides the soreness that you're gonna have from the adjustment.
No.
Not hurting anywhere?
Right here, I can't tell if it's just the soreness or just tensions.
Okay. Lay down here on your stomach. Now, I am gonna do some deep tissue trigger point therapy on you right now. This, you're probably not gonna like this. This is one of those hurt so good things. I'm putting specific pressure on your trigger points in your rhomboid muscles right now. I'm gonna bring this arm up like this, kind of get your scapula to wing a little bit. Ooh, that's really bad right there, huh? If this gets to be too much, tell me.
Okay.
Cause I know it smarts, but it'll feel better when it feels better. It'll feel better when it quits hurting, I mean. There we go. Oh, wow, that's a tight one. That's pretty tender, isn't it?
Mhm.
Is that where you feel most of the pain?
Yeah.
Yep. Okay. Yeah, see, this is my wrestling move. Okay. You can stand up and move right around now and tell me how your right shoulder blade feels right now compared to when you walked in.
Better.
Better?
Yeah.
Good. So, here, let's take another look. Okay, look in the mirror right now. See, you're more centered up, your shoulders are squared off better, your pelvis is more down the middle. So how do you feel right now after your very first chiropractic adjustment for your quote-unquote fibromyalgia compared to the medical treatment that you've had for it?
Like I actually had an adjustment.
Mm-hmm. Can you move easier and have less pain?
Yeah.
Okay, good. So what would you tell people about your first experience here at Advanced Chiropractic Relief?
That was great, and hopefully I could come back if I need to.
Yeah. We'll leave that up to you. You're coming from Lubbock, so I'll put you on an as-needed basis. So you can just come down here when you feel like you want a tune-up.
Perfect.
You did great on your very first
Thank you very
adjustment. Thanks for
much.
sharing it with everyone. This is your Houston chiropractor coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.